It is May 14th, 2013. Welcome to Lunch Break. I'm Wendy Bounds. Oscar-winning actress Angelina Jolie disclosing she underwent a double mastectomy after learning she carried a gene that made it likely she would get breast cancer. What options are out there for women in a similar situation? Joining us here is Dr. Joseph Dayan, Beth Israel, Director of Plastic and Reconstructive Surgery Research here in New York. Thank you so much for being with us, Doctor. A lot of questions swirling this morning. Let's just start with some of the basics. The BRCA1 and the BRCA2 gene, which a lot of people will be reading about today in connection with Angelina Jolie, what are they? And if you carry one of these genes, what are your odds, your risk of developing breast cancer?
Thank you, Wendy. The BRCA1 and BRCA2 genes are DNA repair genes. So every day your body's replicating its own DNA, it makes mistakes, and these are genes that fix those mistakes. And when those mistakes don't get fixed because of a mutation in this gene, that can lead to cancer cells. The risk of developing breast cancer with this gene mutation is at least 60%, but it differs in individuals depending on your family history and your own medical history, and that can be upwards of 80%.
And that is what Angelina said that her odds were. She said they were fairly high at 87%. For someone whose odds might be, say, more in that 60% range, how do doctors and physicians such as yourself counsel patients who may come in and say, you know, having a double mastectomy is a really big deal. I'm not sure I'm ready to go through with that. What should I do, doctor?
I think most patients are really driven to conclusion about proceeding with a double mastectomy because they've lost a family member, such as a mother or a sister, and it really becomes a decision, a life-saving decision. We as medical professionals just provide what that means to have a double mastectomy: loss of sensation, loss of that feeling of being complete. But also newer reconstructive procedures have led to higher rates of prophylactic mastectomies because results these days are much better.
Let's talk a little bit about the surgery that Jolie underwent. I mean, she had noted that her own mother died at 56. She has 6 children. She said she wanted to be able to assure them as best she could that she would be there for them. Her surgery it started with something called a nipple delay. Then she had the breast tissue removed, and then later she had implants put in. Can you walk us through a little bit about how those procedures work?
Sure. What she had is really the latest in breast reconstruction, a nipple areola sparing mastectomy, which allows one to preserve the nipple areola complex, which really makes the breast look very real even in a reconstruction. A nipple delay procedure is severing some of the blood supply before the mastectomy occurs and also sampling the tissue underneath the areola. Because if there were any cancer cells that were found, they could not preserve the nipple areola complex. This basically turbocharges the blood supply to the nipple so that after a mastectomy, the blood supply will likely be enough and the nipple will survive. In Miss Jolie's case, she had implant-based reconstruction, which is typically a staged procedure, meaning there are 2 or even 3 procedures where a temporary implant is placed that's partly deflated, called the tissue expander. This allows the skin to heal without tension on the blood supply that can cause wound breakdown. Several months later, that's replaced oftentimes by silicone gel implants, and this can be there can be fat injections, the use of dermal matrices, and all kinds of new technologies to make the result look very natural. And the other alternative is using your own tissue, often with microsurgical transfer, like getting a tummy tuck, but using that skin and fat to make a breast instead of throwing it away.
And Angelina Jolie, doctor, writing about how supportive her partner, Brad Pitt, also an actor, has been through this entire process. You know, I know a lot of breast cancer survivors who talk about how important that is, and also how important it is to have a team behind you in the medical community, not just a plastic surgeon such as yourself, but a breast surgeon, a genetic counselor as well. Do you find that more hospitals are putting this team together for people who are considering undergoing the surgery such as Angelina did?
Yes, I think a team approach is ideal. It's important for both the breast surgeons, the plastic surgeons, the oncologists, the geneticists, radiation oncologists, all to be on the same page, because as the treatment of breast cancer has evolved, a lot of what drives people to prophylactic mastectomy really, in part, is what type of result they can obtain after surgery. And the type of result on the reconstructive side depends on the breast surgeon side, and the plastic surgeon has to understand the oncologic implications and the challenges we all face. So as a team, I think the medical community has made incredible leaps in breast reconstruction and breast cancer treatment together.
And Angelina Jolie, 37 years old, do you think this disclosure will put at ease and make it easier maybe in some ways for people, young women considering having this preventative surgery?
I think she's been so articulate, and I think her story that was written earlier in the Times today will reach out to a lot of women. I think, you know, somebody who's an icon of beauty undergoing a procedure really so that she can be there for her children in the future will affect a lot of women in a positive way.
All right, Dr. Dayan, thank you so much for sharing your expertise with us and your thoughts. I appreciate your being here.
Thank you, Wendy.